The Patient Protection and Affordable Care Act. Impact on Healthcare Access, Cost, and Quality. Presented today by Lakeisha, Funmi, Chris, Denise, Holly, Jahida, and Heather. Today we will review what is the status of those who were newly covered, what are exchanges and how are different states approaching them, what does Medicaid programs have to do with the Affordable Care Act, how have health insurance premiums been affected, what variables are in play in the political debate over the impact of the HCA on cost, access, and quality of care, what are some key challenges facing state and national policymakers given in the current status. On balance, has the ACA been a good or bad law? The Affordable Care Act significantly increased health insurance coverage in the U.S. by expanding Medicaid, creating insurance marketplaces, and instituting protection for individuals with pre-existing conditions. Medicaid expansion. Under the ACA, Medicaid eligibility extended to adults earning up to 138% of the federal poverty level, benefiting low-income adults, particularly childless individuals who previously did not qualify. Studies have shown expansion states show major uninsured rate reductions, especially among minority groups. ACA marketplaces. The ACA established health insurance exchanges where individuals could purchase insurance with income-based subsidies. Those earning 100 to 400% of the federal poverty level qualified for financial assistance, making insurance more affordable. The American Rescue Plan Act of 2021 further increased subsidies, expanding affordability for middle-class families and the self-employed. Young adults up to age 26. The ACA requires that insurance providers to cover dependents until the age of 26, leading to a significant decrease in the uninsured rate for individuals 19 to 26 years of age. This provision helped those transition from school to the workforce. Pre-existing condition protections. Before the ACA, insurers could deny coverage or charge higher premiums based on health status. This law prohibits such discrimination and mandates essential health benefits in all plans. This change significantly increased access for individuals with chronic illnesses, disabilities, and other medical conditions. Previously, ineligible low-income adults. Before the ACA, Medicaid eligibility was strictly limited in many states. The ACA's Medicaid expansion reduced these barriers, but non-expansion states still have high uninsured rates among low-income adults. Immigrants and refugees. Lawfully present immigrants, including green card holders, refugees, can purchase ACA marketplace plans and receive subsidies. However, most undocumented immigrants remain ineligible for ACA coverage and Medicaid. Health exchanges are often referred to as health insurance marketplaces. This platform assists individuals and small businesses seeking health insurance plans while creating a competitive market for insurance carriers, which helps drive overall costs down. Health Exchange offers the ability to compare a variety of plans, review eligibility, and provide assistance for enrollment, guidelines, and qualifications. Health marketplaces can be both federally and state run. Health insurance plans through public insurance exchanges must be compliant with the Affordable Care Act, which indicates the coverage must accept pre-existing conditions and offer at least 10 essential health benefits, including but not limited to preventative and acute care coverage. All coverage must also include the top needs of public health challenges, include social determinants of health and chronic disease management. Federal guidelines, applications, and information are offered through the Center for Medicare and Medicaid Services through their website as a resource, along with healthcare.gov for enrollment, additional resources, applications, programs, and forms. Individual state health exchanges vary in availability, open enrollment periods, eligibility, out-of-state coverage, and tax credit eligibility. Individual states often negotiate directly with health insurance carriers to determine what plans they will participate with and the list for access of for individuals. Typical marketplace open enrollment starts November 1st and runs through the end of the year, early beginning of the following. Individual states, again, may vary. As of 2024, only 19 states had a state-run health exchange marketplace. This includes most of the Northeast states of the US, a few Midwest, and majority of the West Coast states. All others continue to participate with only the federal exchange, offering plans between exclusive provider organizations, health maintenance organizations, point of service, preferred provider organization, and high deductible plans. Ultimately, the addition of health insurance exchanges from a federal and state perspective have aided millions of individuals within the United States to have access to affordable health care. State coordination of Medicaid, Individual State Children's Health Insurance Program, or CHIP, and subsidized coverage on health insurance exchanges was mandated under the Affordable Care Act. With incomes at or below 138% of the poverty threshold, Medicaid was now mandated to provide coverage to parents and those without dependent children. The ACA mandates that the federal government will pay the whole cost of Medicaid expansion for each state, with a gradual reduction in federal government cost sharing down to 90% in 2020 to alleviate the financial strain of insuring additional people. In addition to Medicaid expansion, the Affordable Care Act instituted several reforms to the private insurance market, including removing exclusions for pre-existing conditions and setting annual limits on out-of-pocket expenses in an effort to increase the number of Americans with health insurance. The bill also mandated that most people have minimal needed coverage and let young persons to stay on their parents' insurance policies until they turned 26. For a few statistics, nearly 50 million Americans, or 1 in 7 Americans, have obtained coverage via the Affordable Care Act marketplace since January 2014. According to the new data issued by the U.S. Department of Treasury in 2024, nearly 4.2 million more people with household incomes below 250% of the federal poverty threshold registered for coverage than during the open enrollment period last year, providing that people enroll when coverage is affordable. Over the past few years, health insurance premiums have been steadily increasing. For example, in 2023, the average cost of an employer-sponsored family health plan rose by 7%, reaching about $25,500 annually. Similarly, premiums in the individual market saw a rise, with the average family plan costing approximately $21,000 that same year. This increase has been driven by a combination of rising healthcare costs, inflation, and an uptick in the use of healthcare services as people sought care that had often been delayed during the pandemic. Several factors have contributed to this trend of rising premiums. The COVID-19 pandemic significantly impacted healthcare usage, which delayed treatments and elective surgeries, adding to the overall demand for medical services, thus increasing costs. Additionally, the insurance markets have become more consolidated, with fewer companies dominating local markets, reducing competition and pushing prices higher for consumers. Economic factors such as inflation and rising labor costs in healthcare facilities have further driven up the prices that insurers must cover, contributing to the increasing premiums. Policy changes have played a role in increasing premiums, particularly with the expiration of enhanced subsidies under the Affordable Care Act in 2023. These subsidies had been helping individuals with lower incomes to afford their health insurance, but without them, many people have seen their premiums increase significantly. As a result, some individuals have faced difficulties affording coverage, potentially contributing to increase in the number of uninsured people. Looking ahead, health insurance premiums are likely to keep rising, with future changes largely dependent on broader economic trends and potential policy reforms. The ACA has increased insurance coverage, reducing uncompensated care and potentially lowering costs in the long run. Subsidies and Medicaid expansion have made healthcare more affordable. Increased regulations, mandates, and administrative burdens have raised premiums and overall healthcare spending. Expanding Medicaid and preventing denial of coverage for pre existing conditions has increased access for millions. Some insurance plans under the ACA have limited provider networks, leading to longer wait times and difficulties finding care. ACA driven payment models like value based care and accountable care organizations have improved care coordination and outcomes. However, government intervention in healthcare has led to excessive bureaucracy, with which some say limits innovation and physician autonomy. The ACA has helped reduce disparities by expanding insurance access across racial, ethnic, and socioeconomic lines. Coverage does not always translate into access, especially in underserved areas where provider shortages persist. The shift to value based care can incentivize a more holistic, patient centered care. Increased regulatory burdens, reporting requirements, and administrative work have contributed to physician burnout. Since the 2016 presidential election, the Affordable Care Act has been tested numerous times and still influences policymakers at the state and federal levels. Legislative uncertainty has been one of the largest hurdles, as several attempts to repeal or replace the ACA, particularly by the Trump administration, have created an uncertainty in healthcare markets. Further elimination of the penalty for failure to comply with the individual mandate in the 2017 tax bill has generated concern about increased premiums and an unhealthy risk pool as many healthy people opt out of coverage, resulting in increased cost for all. The second major issue in state variability, or the uneven growth of Medicaid. While the ACA allowed for Medicaid expansion to cover low income individuals, many states refused to participate, leaving millions without affordable health care coverage and creating a patchwork system across the nation. States also have leeway in implementing ACA rules, leading to diversity in access and quality of coverage across states, which can lead to variations in healthcare outcomes. Rising premiums have also been an issue, with insurance premiums increasing in the majority of ACA marketplaces. This has been driven by uncertainty created by policy, as well as insurers' withdrawal from individual markets. With fewer healthcare members in the marketplace, there is an unbalanced risk pool that makes it challenging to ensure affordable premiums for everyone. With these rising costs, coverage is also less available in rural areas, where fewer insurers operate, reducing competition and driving up costs. Moreover, this coverage cliff leaves individuals just above the subsidy eligibility threshold without affordable coverage, creating a substantial barrier to care for many. The ACA has also faced several court challenges, some of which have questioned its constitutionality and underlying provisions such as pre-existing condition coverage and essential health benefits. These ongoing court challenges bring uncertainty to the future of ACA and make it harder for consumers and insurers to plan with confidence. Besides, despite the ACA having an enhanced health equity, healthcare disparities in access and outcomes continue to exist, especially among low income and minority populations who are still faced with obstacles to treatment. While the fight continues, there are also policymakers pushing for a public option or Medicare for all. These proposals envision the extension of the ACA through an insurance option operated by the government or movement towards a single payer health system. Yet they face mammoth political and operational challenges. Finally, the ACA also has to deal with the technological and administrative challenges such as enrollment system problems and complexity in managing its various regulations. These difficulties make it difficult to ensure that the system is operating effectively and equitably across all states and populations. On balance, most experts agree that the ACA has been considered a good law, as it has improved coverage for more than 20 million people. reducing the uninsured rate. On the day former President Barack Obama signed the ACA, 16% of Americans were uninsured. In March 2020, it was 9%. Despite its repeated attacks, not only has the ACA survived, it has thrived and continues to provide tens of millions of Americans with access to healthcare coverage.